Hi, everyone. Today I'm going to talk about osteoporosis prevention. As we age, our bones tend to become weaker and weaker. In fact, 30% of women and 40% of men over the age of 50 will suffer from an osteoporotic fracture in their lifetime. So today, I want to give you some tips that you can do right now to prevent osteoporosis so you can maintain your mobility as you age. One is to get enough protein. Protein is essential for bone health. In fact, it is a major component of bone tissue. As we age, our protein requirements stay the same, but our protein turnover rate increases. This means that our bodies are constantly breaking down more protein than ever before. And if we don't consume enough protein, then our bodies will start breaking down bone tissue to get the protein it needs. To help increase your protein intake, eat a protein-rich breakfast, such as eggs, Greek yogurt, or cottage cheese. Choose protein sources that are higher in leucine, such as animal products, soy, and quinoa. Also, eating protein with every meal will help you spread out the workload for your kidneys, which is important as we age. 2 is getting enough calcium. It is estimated that 68% of Americans are not getting enough calcium in their diets. Calcium is very important for bone health, but it is also crucial for many other functions throughout the body. Low calcium levels can cause cramping and pain in your muscles, including your heart, which is why low calcium can cause irregular heartbeat. Low calcium can also cause brain fog, depression, and anxiety, as well as insomnia. So how do we get enough calcium? Well, dairy products are usually loaded with calcium, but there are also foods like kale, broccoli, tofu, almonds, and salmon that are high in calcium. If you are worried about getting enough calcium, then you may consider taking a supplement. However, I would recommend trying to get most of your nutrients from food rather than supplements, if possible. One warning about calcium supplements is that they tend to be high in amounts of vitamin D, which can be toxic to your body if taken in too large of quantities. If you do take a calcium supplement, make sure it has less than 600 IU of vitamin D. 3 is making sure you get enough vitamin D. Studies have shown that roughly 75% of people are not getting the recommended amount of vitamin D. It is very important for bone health because it helps the body absorb calcium. Without enough vitamin D, your body will not be able to absorb enough calcium, leading to weak bones. The best way to get vitamin D is by spending time outside in the sun. However, this should be done in moderation since too much sun exposure can increase your risk of skin cancer. Some foods that are naturally high in vitamin D include fatty fish, beef, liver, and egg yolks. If you decide to take a vitamin D supplement, be careful not to take too much. As I mentioned earlier, calcium supplements tend to be high in vitamin D. But vitamin D supplements can also be high in vitamin D, so make sure to check the label before taking any supplements. Too much vitamin D can lead to hypercalcemia, which can cause symptoms like nausea, constipation, confusion, and even kidney stones. 4 is to exercise regularly. Weight-bearing exercises such as walking, jogging, dancing, and strength training are great for bone health. These types of exercises put stress on the bones, which actually makes them stronger. In fact, studies have shown that weight-bearing exercises can reduce the risk of fractures by up to 35. Another benefit of exercise is that it helps your body absorb more calcium. Exercise also increases your vitamin D levels, which, as we discussed earlier, is essential for bone health. In addition, exercise will help maintain your muscle mass and strength, which will help prevent falls. Falls are one of the leading causes of fractures in seniors. So doing exercises that focus on balance control, such as Tai Chi, can be especially helpful for seniors. A study published in the Journal of the American Geriatric Society found that practicing Tai Chi for 1 hour per week significantly reduced the risk of falling. 5 is to avoid smoking and limit alcohol consumption. Smoking decreases bone density and increases the risk of osteoporosis-related fractures. Alcohol consumption in excess can also lead to bone loss. In fact, drinking more than 2 alcoholic beverages per day increases the risk of osteoporosis. 6 is to limit caffeine intake. Caffeine can interfere with the absorption of calcium, which, as we know, is essential for bone health. Drinking more than 3 to 4 cups of coffee per day can lead to increased bone loss. 7 is to watch your salt intake. High salt intake can lead to calcium loss through urination. This can lead to decreased bone density over time. The American Heart Association recommends consuming less than 2,300 milligrams of sodium per day. No. 8 is to watch your sugar intake. Consuming too much sugar can lead to inflammation, which can break down collagen in your bones. In addition, high sugar consumption can lead to obesity, which puts extra stress on your bones. High sugar consumption can also lead to malnutrition because it fills the stomach, preventing you from absorbing nutrients needed for bone health. No. 9 is to make sure you get enough vitamin K2. Vitamin K2 plays an important role in bone health by helping the body metabolize calcium. Without enough vitamin K2, calcium can build up in the arteries, which increases the risk of heart disease. However, vitamin K2 also helps direct calcium to the bones, making them stronger. Leafy green vegetables are usually rich in vitamin K2. However, it is important to note that cruciferous vegetables like kale and broccoli contain oxalates, which can bind to calcium and prevent its absorption. So cooking these vegetables can help decrease the oxalates and allow more calcium to be absorbed. Other good sources of vitamin K2 include grass-fed butter, cheese, and fermented veggies like sauerkraut. Number 10 is to make sure you are getting enough magnesium. Magnesium works with vitamin D and calcium to build strong bones. In fact, magnesium deficiency has been linked to low bone density. Good sources of magnesium include pumpkin seeds, chia seeds, spinach, and avocado. However, it is important to note that spinach also contains oxalates, so it is better to cook spinach to reduce the oxalates and allow more magnesium to be absorbed. You can also get magnesium from supplements, but I would recommend getting your nutrients from food whenever possible. Number 11 is to eat anti-inflammatory omega-3 fatty acids. Omega-3 fatty acids, such as those found in fatty fish, have been shown to reduce inflammation throughout the body, including the bones. In fact, a study published in the Journal of Clinical Endocrinology and Metabolism found that increasing omega-3 intake was associated with an increase in bone mineral density. Other foods high in anti-inflammatory omega-3 south include walnuts, flax seeds, and chia seeds. Number 12 is to eat bone broth. Bone broth is rich in gelatin, which is made up of amino acids like glycine and proline. These amino acids are important for maintaining cartilage and bone health. In fact, a study published in the Journal of Clinical Biochemistry and Nutrition found that consuming 1 liter of bone broth per day for 6 months significantly increased bone mineral density in postmenopausal women. Number 13 is to eat foods high in boron. Boron is a very exciting trace mineral that has recently gained attention for its potential benefits in bone health. A study published in the Journal of Medicinal Food found that supplementing with boron increased bone mineral density in postmenopausal women. Foods high in boron include avocados, nuts, berries, leafy greens, and legumes. So those are 13 things you can do to prevent osteoporosis. Maintaining bone health is essential as we age because it will help us maintain our mobility and independence as we grow older. Our bones are constantly being broken down and rebuilt. So it is important to make sure we are giving our bodies the tools it needs to rebuild strong bones. Just by making small changes to your diet and lifestyle, you can improve your bone health and reduce your risk of osteoporosis. Thank you for watching, and I hope you are having a healthy and happy new year. If you enjoyed this video, please hit the like button and subscribe for more health and wellness content. Have a wonderful day.